Hi, I'm Dr. Robin Deutsch, Associate Medical Director at CHR, and I'm an addiction specialist and a primary care doctor.
Hi, I'm Kate Battista. I'm an LPC and I'm the Clinical Program Director of the Enfield Pathways Methadone Program. And this Medical Minute is going to focus on infectious diseases. Dr. Deutsch, what are some of the most important or most prevalent infectious diseases that we need to be aware of?
Sure. HIV and hepatitis C are two viral infections that are very common in people who have a history of substance use and also in mental illness.
Okay, so let's start with HIV. What are some of the keys in terms of who should be tested and how often, and how can we help with that process?
Well, the CDC recommends that all adults and adolescents ages 13 to 65 be screened for HIV at least once in their lifetime. This can be done in a primary care setting, any facility where someone is accessing medical care. It should be done as a matter of routine. Just like checking for diabetes or high blood pressure, it should be something very routine and mainstream without a lot of bias or stigma associated with it.
Okay, and what about for those people who may be at higher risk? Is their testing any different?
Yeah, so people who have risk factors for HIV should be screened more often if they're using drugs or sharing syringes, or if they have multiple sexual partners or having unprotected sex, and they should be screened yearly potentially, and any woman during pregnancy also should be screened.
Okay. And what are some things that anyone can do to help prevent transmission of HIV?
There are a few strategies that are dramatically effective at reducing the spread of HIV. One strategy is getting people who are infected onto treatment quickly and making sure that their amount of the virus is suppressed by medication that they're taking consistently. And that will decrease the risk of transmission to a partner by 93%. Another strategy is what's called Exposure Prophylaxis, which is for people who are negative for HIV, but they may have risk based on their number of sexual partners, or having sex without condoms, or history of sexually transmitted infections, or a partner that's HIV positive that they may be using drugs with. They can be eligible for a 1 pill once a day that they take to prevent them from getting HIV. Another strategy is getting people who are using drugs onto medication for opioid use disorder to help decrease the frequency that they are using needles.
And if someone does find out that they are HIV positive, what do some of those treatments look like?
Treatments nowadays for HIV are very easy, as simple as 1 pill once a day with minimal side effects. And people can take treatment and be healthy and live fairly normal lives and live well into their 60s or 70s. And they're unlikely to be sick from infections related to their HIV or progress to AIDS, which is a state of having the immune system weakened. They're more likely to pass away of conditions that affect the general population, like cardiovascular disease or cancer.
What is the screening process for hepatitis C, and who should get tested?
So hepatitis C also is recommended now for all adults 18 and above, that they be tested at least once during their lifetime. There have been increasing numbers of infections in younger people, ages 20 to 39, over the past decade. And it's a blood test that can check for antibodies to see if the person has been exposed to the virus in the past. If the antibody test is positive, then there's an additional test to show whether that virus is still lingering in the system. About 20% of people who have been exposed to hepatitis, their body will naturally clear the infection. Another 80% will have chronic infection that can last for decades. And over decades, it can do damage to the liver and cause some scarring, and eventually, in a certain number of people, can progress to what we call cirrhosis and liver failure. So it is really important to get people treated early on to reduce the damage that can happen with hepatitis infection over the years.
So what are some of those treatments like now?
Hepatitis C treatment has come a long way. In years past, there were injections and medications, and they had a lot of side effects, and they didn't work very well. Now, we're so fortunate to have simple regimens as easy as 1 pill once a day for 12 weeks, or even 3 pills for 8 weeks, with minimal side effects and a 97% chance of cure. So it is a really great time for people to get hepatitis C treated.
One of the things that I do know about people who have hepatitis C is that a lot of times they might not have any symptoms. What would you say to clients or people who are positive that don't have symptoms that are hesitant about getting treatment?
Mm-hmm. Many people who are infected don't know that they are. Up to 30% of people may have hepatitis C infection and not have any symptoms at all. Other people who may have symptoms could be very subtle symptoms like fatigue or weakness, joint pains, muscle aches, and also people can have certain cognitive or memory symptoms or mood symptoms. So they can have depression or anxiety, difficulty remembering things, and especially for individuals that have a history of a mental health disorder, there can be some overlap. And hepatitis C and HIV also can exacerbate some of those symptoms.
And in terms of hepatitis C and HIV treatment, is that something that we're able to offer at CHR at all?
We can offer that at CHR. We are taking referrals in the family medicine clinic. I am an infectious disease specialist, and I can treat patients with HIV and hepatitis C integrated into the primary care setting and also in collaboration with their mental health or addiction providers.
And that was going to be my last question, is how can clinical staff or support staff assist in that referral process or getting patients linked to treatment?
Having conversations with patients about their medical history, and if a staff member identifies that they have HIV or hepatitis C and are not linked to a provider and are not in treatment, then they can do a referral either to our clinic or to an outside provider. And if they've never been screened before, then they can recommend that a person get HIV or hepatitis C testing.
Thank you. Thank you for watching our Medical Minute. See the link below for more resources or information.